active police scene caused traffic delays for hours across Lexington yesterday. A lot of folks know about that and were caught in it. It was a situation involving an armed suicidal person on Bryan Station Road.
Police say it ended with that person shooting themselves. He was taken to the hospital with life-threatening injuries. Tonight, WKYT's Samantha Valentino shows us how the city's first responders handle someone in crisis.
Oftentimes, when Lexington E911 receives a call about a person in a mental health crisis, both police and the fire department respond.
It is a team effort.
Captain Seth Lockhart is with the fire department's community paramedicine program. He says one of the things the paramedics on scene will do is make sure the crisis isn't a medical situation.
There are some medical situations that kind of may look like a behavioral health, and so the paramedic can be there to help kind of rule some of that stuff out.
From there, they're working in partnership with police.
De-escalation is the big word. It's anytime we get on scene, we need to get people down to a level where we can actually have a conversation with them. So if we get somewhere and they're amped up, then our first goal is we're going to try to get them to come back down.
Detective Benjamin Taylor says almost all of the Lexington Police Department's officers have undergone crisis intervention training. Because of this, he says sometimes the responding officers are able to handle the situation on their own. However, some calls require calling in more resources, such as the fire department's community paramedicine team, which Detective Taylor is assigned to.
And it's a multidisciplinary team where we come together and try to problem solve and get people connected to the resources that they need.
The team of first responders are able to go beyond responding to the initial call. They look for long-term solutions for people facing a mental health crisis. In Lexington, Samantha Valentino, WKYT.
In January, Lexington announced that they had received a federal grant to establish a crisis response team. The $850,000 will also be used to hire a full-time mental health professional to work alongside the police department. The city says the program is not yet up and running. If you or anyone you know is struggling, you can call 988 for the Suicide and Crisis Lifeline.